Hai, Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Farawahida binti Aziz. So today we would like to present about our system named Clinic Management System.
And my name is Mohammad Aibi Rizadi.
My name is Fatin Nur Amalim binti Faizu from CS2304P.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nuzaini binti Abdul Ghani.
Assalamualaikum. My name is Siti Asya binti Basaruddin. I'm from CS2304B.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Husnina binti Jamaluddin.
So I would like to introduce about our system first. Clinic Management System is the system to ease the burden of the staff at the clinic. This system creates a systematic record of patients, helps staff in managing the patient information as well as medicine details, and minimize the loss of data. So next is identification. For the system number is SYZ-2021-11. For the system name is Clinic Management System. For the system abbreviation is CMS. Okay, next is subsystem number is not applicable. For the subsystem name is also not applicable, and for the subsystem abbreviation is also not applicable. Yes. Okay, for main reason of the system project is to create a systematic record of patients. Next, to help staff in managing the patient information as well as medicine. Next, to minimize the loss of data. And the last one is to improve the efficiency in registering the patient's information. Okay, next we move to for our vision is first, clinic management system aims to consistently serve the changing needs of clinic staff. Next is this system allow the staff to maintain the patient information to add or remove the patient or overall system. Okay, for our mission is first, clinic management system will be the most up-to-date system available. And the next is to generate a friendly system record with ease of use, and it can save a lot of information without the data interchangeable. Okay, for the objective is first to make a system platform to keep in the information data is an existing clinic. The second is providing an online system where the clinic staff can easily keep the information data and faster the outcome from the staff. And the last one is to provide the fastest service for patient.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nuzaini binti Abdul Ghani, and I will explain about government document, where we refer from Unit Kawalan Amalan Perubatan Swasta Jabatan Kesihatan Negeri Selangor. The document consists of procedure of patient registration and attendance, where all new patients need to register using their IC number for Malaysian citizen or passport for non-citizen. It also consists of provision medical record, fee schedule, staff identification, infection control, and sterile supplies.
Next, non-government document. Non-government document, the first one is document formats. So the format for all documents depends on our company. So the documents that included is letter, reports, medical certificate, and invoice. Next one is provision of records. So in our company, the compilation of record of disease will be produced in any form, either tables or charts. It will be displayed on main interface of the system. So record of patient, the attendance for patient in the clinic, registration for patient in the system. So it will display on main interface of the system, such as number of patient for each disease, number of patient who are attending the clinic each month, according to the gender, according to the age, and also patient's feedback. Next one, provision of reports. So report of patient who are assessed or have been registered in the system, the clerk will make a report for the doctor to save it or print it out. So if the appointment is the second time, the doctor can check the patient's information and check history if the patient wants to make a new appointment. Next one, letters from company or doctor. So letters such as letter of exemption from a social welfare officer, from a company or panel doctor will be required. First one is provision of medical certificate. So this MC to the patient stating that the patient is unable to work because of medical reason according to the number of days given until the patient recovers. And second one, provision of letter for confirmation of employment. So this document ensures that the individuals accepts the job according to the position. So the document must consist of appropriate information and also obtain the signature before being sent. And also must include it with the education level and notice to bring all an acceptable document that is not expired. Next one is medical service. Medical service is clinic will involve the provision of existing facilities and services. So provision of emergency room when a patient falls ill or suffers an injury that requires immediate treatment. So in our company provide emergency patients equipment such as bed, elbow crutches, and also wheelchair. Next one is provisions of patients equipment. So provision of equipment to treat. So the first one, provision of equipment to treat patient. For example, like diabetes that needs to be checked up like every 3 months. So they need to go through blood glucose tests by using insulin and a lancet with warranty that can be tested at the patient's home. The last one is health information. So health information is guidance for a patient to improve a healthy lifestyle. For example, like balanced diet, fitness, quit smoking, stress management, and so on. And the last one, information for disease and condition. So information of all disease listed in the system, which included overview, symptom, cause, diagnosis, and also the treatment. This information will be displayed on the main interface of the system.
For functional requirement, these requirements are essential to delivering benefits to the user. For the CMS functional requirement, it consists of login and logout, sign up patient, sign up employee, update patient details, delete patient details, update employee details, delete employee details, register appointment, update appointment, generate bill, medical certificate, print patient list, print appointment list, and search.
Next, we will present the clinic management system, non-functional requirement. This section describes the general non-functional requirements for the system. There are 5 non-functional requirements. The first one is reliability. All appointments and data should reach the admin without any errors. Patients and staff can book and check their appointments in the system. For the second requirement is usability. The system must be user-friendly and easy to understand and use. The user should be able to navigate and use the system. The third one is security. Security, in terms of security, access to the system shall be by use of a login ID and password. Any given user should be able to access the interface and print reports to which are available to their user level. The fourth one is the performance. The system written result will proceed faster in less than 10 seconds and the performance changes with higher workloads. And the last one is portability. This system is not expected to run on anything but a Windows platform.
Okay, next I will explain about the definition. The first definition is Malaysian Medical Council. In the course of providing safe and competent healthcare services for the country, the Malaysian Medical Council was established by an Act of Parliament approved on 27 September 1971 and gazetted on 30 September 1971. Medical practitioner is an individual who is licensed or otherwise authorized by a state to provide healthcare services, or any individual who the health authority hold himself or herself out to be so licensed or authorized. Healthcare supplier is a physician or other Tiona, a facility or other entity, other than a provider of services that furnish items or services.
Alright, next will be the roles, and we have three roles in the system. We have patient, which is an individual who will provide their biological information to complete the patient registration, pick an appropriate time for the appointment and attend them, and at the same time receive bills including for the payment for each of the appointment. Next will be clerk, is a person who will handle patient and employee registration, assigning proper time for the patient appointments and patient bills and update any record necessaries. Next will be doctor, a health professional who prescribes medication to the patient. It's possible that they could be a specialist or a family physician. Okay, next would be activity diagram. The first part will be login for clerk and doctor. Both of them require to log into the system to use the system. And if there's a log error, they need to re-log in once more. Next would be, let's say if a patient requests to be registered, the clerk can do so by requesting the patient information, and then at the same time it will check whether if the patient already exists in the database, else it will store into the database right away. Next is, let's say if a patient requests to make an appointment, the clerk will also do so by checking doctor availability and then receive an appointed date, available date, and the patient could also provide their own specific date if they would so, and then later on it will insert to the database right away. Next would be generating bills. The clerk will actually generate bills by checking the medication prescription and get based on the prescriptions and generate the bill to the self. Now, next would be signing up for employee. For clerk could actually request for any employee details, which is especially clerk, and then it will check whether if the clerk or employee actually exists and store them right away into the database. Next would be deleting doctor details. Well, it would search for the specific doctor that you would like to change, and they can update or even delete at that moment. And let's go to doctor. Alright. So doctor can request any sort of appointment to view which patient they actually have for the day. And doctor can also attend for the appointment based on which patient they need to appoint it. So that's all will be the activity diagram for the CMS system.
I will explain about the use case diagram. So in clinic management system, we have 6 use case, which is sign up patients, sign up employees, manage user details, make appointment, manage appointment, and generate bills. We also have 3 entities, which is clerk, patient, and doctor. So all these action can be referred toward the activities diagrams. That's all. Thank you.